Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department, and welcome to our weekly briefing. Today on Thursday, October 29th, we are reporting a to-date total for the Tri-County of Peoria, Tazewell, and Woodford at 8,413 cases. That's an increase of 918 cases in 1 week. For Peoria County, we are reporting 4,866 cases. Tazewell County, 2,834. And for Woodford, 713 cases. We are saddened to report 3 additional lives lost to this virus. That includes a Peoria County resident, a male in his 70s, not associated with a long-term care facility, as well as 2 Tazewell County residents, 1 male in their 70s and 1 male in their 90s, both residents of a long-term care facilities experiencing outbreaks. I do want to highlight today that Peoria County added 100 new cases in a day. That's our highest single day increase since this pandemic began.
Oh, it is?
Our 7-day average is now 67 for Peoria County, and for the Tri-County is 131. It's safe to say that there is a very sharp incline in our number of cases, both here in our Tri-County and within our region. In regards to our cases, 81.2% of our cases are considered recovered, while 16.7% are at home and isolating.
I'm sorry, say that number one more time.
16.7% are at home and isolating, and 0.3% are hospitalized. During the governor's press conference today, he mentioned the various regions and how they're moving forward. Peoria, Tazewell, and Woodford are part of Region 2, and currently our metric stands that we have seen 5 days of increased positivity, sitting at 7.9%, and our hospital admissions have seen 3 days of increased admissions, currently at 18. Even more surprising is that our hospital med-surg and ICU now trends below 40%. In regards to our hospital data here locally for OSF St. Francis Medical Center and Unity Point Health Peoria, which includes Methodist, Pekin, and Proctor, we currently have 20 individuals in the ICU and 71 in non-ICU beds, and are saddened to report 1 death in the past 24 hours. The 7-day ICU increased to 21 in our Tri-County from last week, and our med-surg increased to 57. In fact, today our ICU capacity is at 15% for COVID-19 patients and close to 9% for our med-surg for COVID med-surg capacity. People might interpret these numbers as low, but remember, these are only for COVID cases. The hospitals are still addressing individuals with heart attacks, strokes, accidents, other respiratory issues, and the like. And again, this is a lagging indicator. With increased cases, you then have increased hospitalizations, which leads to increased ICU needs, and then sadly, increased mortality. So how do we stop this? Again, it's going to be those non-pharmaceutical interventions that we have been talking about since the beginning. First and foremost, wear a mask. It works. It works on multiple levels. One, majority of individuals are asymptomatic or have mild symptoms. So by wearing a mask, you are limiting the transmission of the virus. Maintaining your social distance, keeping that 6 feet apart. And then lastly, practicing good hygiene. Washing your hands, using hand sanitizers when you touch various surfaces. Right now, Region 2 is one of the regions that is not currently under mitigation. But make no mistake, that is eventuality for us. And in fact, as we move into this weekend, we're about to start our holiday season with Halloween. So I want to reiterate the fact that if you choose to do Halloween activities, make sure you follow the guidance that's been provided on not only the website of the Peoria City County Health Department at www.pcchd.org, but also the state website. Practice, in that guidance, it really talks about how you can do safe Halloween celebrations, adhering to the size limitations, social distancing, masking, and again, proper hand washing. In addition, the safest way to celebrate this year would be to look at new ways to celebrate, including having a gathering with just your household, doing a different activity within just your household, utilizing virtual platforms to connect with family members and friends that don't reside in your household. Likewise, if you do decide to do the door-to-door trick-or-treating, things to consider is how do you prevent people from gathering and kind of getting to high concentrations? So perhaps putting a table or something outward so that you can have social distancing and spacing. Pre-packaging items, making sure you practice hygiene, washing your hands thoroughly when you're distributing candy, as well as trick-or-treat with your household members. If you guys are counting, I've now said household members at least 6 times, and that's really key. When we talk about all the guidance, not only for Halloween, but moving into Thanksgiving and to Christmas, your household are the people that live at the same address as you. This is not your aunt that lives in Morton. It's not your grandmother that's in Adams County. It is everyone within the 4 walls of your house. That's your household. Please remember that the guidance is meant to be a way for you to still have these celebrations, but do it in a way that maintains the health and safety of our community. With that, I'll open it up to questions.
Yeah, what I would like to ask Monica is, you talked about the three deaths that we had. First of all, were there any underlying health issues that might have led to their death? 2, we have had 60 some deaths this month. That's almost 2 each day. That's shocking. Is there any common ties that you can see to this? Yes, many of them lived in the same spot, but have you linked some of these outbreaks back to a single spot, to a single party, to a single event, or anything like that? Please.
So the first question regarding whether there were any other comorbidities or other issues regarding the 3 residents that passed away, I don't have that available with me. I do know that 2 of them were part of an ongoing outbreak in a long-term care facility. And I think you made a really good point. In the month of October, we have been averaging 2 deaths a day. That's 2 residents in our Tri-County that will not be celebrating with their families or be able to pick up a phone call and talk to their children or their grandchildren, sisters or brothers. And while we want to always say that, they had a comorbidity, lots of people have comorbidities. The fact of the matter is the virus and the situations that they are in led to their death. And I think by being a little bit cavalier about just saying, it's a comorbidity, loses our focus on the fact that this virus is taking the lives of our residents. And we really need to be very much active and proactive in how we can get ahead of this. Because averaging 2 deaths a day is too many. Regarding why we're seeing that increase, again, it's a number of cases. As cases grow, you're going to see hospitalizations and those individuals that will have a worse impact on the virus on them increase as well. So again, our best way to get ahead of that and to decrease the number of deaths is to decrease the number of cases to begin with. And regarding commonalities that we see in terms of these deaths, a lot of them are associated to long-term care facilities or situations where it's a congregate living setting. And that just by itself creates an environment in where a virus like this can become spread quickly in a population that's highly vulnerable. So is there a magic, kind of one size or this was the kind of key point of it? I think the thing to recognize is that often people will tell me, I don't know anyone that's in a long-term care facility, so it's not on me. That's somebody else. I jokingly said this, but I think it makes an impact. It's the degrees of separation that we have as people. I might not know anyone that lives in a long-term care facility, but my kids go to school. The kid that they play with, their parents, their grandparent might live in a long-term care facility. That's 4 degrees of separation. Likewise, my coworker might have an individual that is on oxygen or has diabetes. We have to recognize the fact that even though it's not my immediate touch point, that the people I interact with also interact with someone. And that's the degrees of separation. So when we talk about social distancing, staying home when you're sick, getting tested, wearing face masks, the idea is that we're spreading that out so that for us to have something go through 7 degrees of bacon, so to speak, it's not going to be quick and overnight. It takes a while. We're slowing it down. We're breaking those connections. And so, again, the best thing we can do to really protect our community is those non-pharmaceutical interventions.
Monica, what is your message to local athletic directors in light of the IHSA's decision yesterday to leave it up to individual schools to decide if they're going to play basketball this season?
So the question about IHSA and I think the updates in regards to basketball, I think that's a question with our school districts working really in coordination with the Illinois Department of Public Health, IHSA, and ISB. And I think I need to recognize the fact that the guidance coming out is really meant to protect our community as a whole. We might not agree with it and like it. And I understand the fatigue is settling in, and there is always those concerns about, well, I heard this one day and this and the other. Everything we're doing is based on science. Science does not happen overnight, and it's not done in a vacuum. It's a systematic approach. And so as time progresses, as we get more information and more data, we're able to make better decisions. Things that we talked about in the March, we have maybe a completely different perspective now. And that's, again, because time has helped us get more information, and that's how science works, and that's how science is meant to work.
I wanted to go back to the hospitalizations. You mentioned we were under that 40% surge capacity. I can't remember if you said that was for the first time or not, but in the hospitalization, we went from 80 people yesterday to 91 today, and we've got 20 people in the ICU. You mentioned that's 15% just COVID patients. Can you give us a little bit better idea of, just how hard-pressed are the hospitals for capacity right now? How much of the ICU is full? I know Mike Cruz on Monday mentioned they're all pretty full, and they all have COVID patients for the most part.
So I don't have the exact values of what their full capacity is at, but to put it in perspective, that is beds in use that would not have necessarily been in use in prior years. And so just from an overall comparison, we've always talked about the concern is our healthcare capacity because it's our limited resource we have. We don't have unlimited respiratory therapists. We don't have ICU beds. We don't have ventilators. And so, again, when we see those numbers start uptaking, things start changing. One, procedures that, and I don't like the term elective because it makes it sound optional, but ones that could, like a hip replacement or things of that nature, those start getting impacted. So quality of life measures get impacted as well. And then if this progresses, then it's the kind of decision of how do you start triaging who gets what resource. And I think the other thing to note about COVID-19, and I know Dr. Sater from Unity Point mentioned it too, is that these people's average time in the ICU is not 2 or 3 days, it's 7 to 10. So the turnaround time we're seeing is also extended. So as more cases increase and more hospitalizations in ICU, you're going to have less capacity at almost an exponential rate than you would for other ICU usages.
So to backtrack there, are we going to start seeing those elective procedures like hip replacements and other things that aren't necessarily urgent for preserving life start going away again very soon?
The question is in terms of when will possibly other procedures be put on hold again, similar to what was happening early on. And the goal is that we don't have to get to that point. I think when we start seeing a dip down to 20%, that's when we're going to start really having those kind of further dialogues and questions. But again, because hospital is going to be your lagging indicator, right? That's why we really set the first parameter to be positivity. Because if you can set that and get ahead of that, then you're kind of trying to stem the tide, so to speak, so before it trickles down to the point where now we have to talk about what operations and what procedures we actually get done.
Going off of that, you mentioned the 7-day rolling positivity now for our region is 7.9. Mm-hmm. Explain how you said now restrictions could be an eventuality. Explain how, because 7.9 is literally a point away.
Yeah. So right now, our region sits at 7.9 for the positivity. And the different metrics about going into mitigation and that tiered approach, one of them is having 3 consecutive days at 8% or above. And so at 7.9, we're just 0.1% away from meeting that first day. And so when that happens, like we saw with Lake and McHenry, it will trigger mitigation efforts in our community.
Monica, are you concerned that after Governor Pritzker was here earlier this week and was touting how Region 2 is doing so much better than the rest of the state, are you worried that people might be getting a bit cocky about, oh, well, it's much worse up in Cook County or, we're in those regions, even though we've gone from 7.2 now to 7.9%?
I think it's a great point. The governor did mention the fact that Region 2, compared to the other 11 regions in the state, is doing better. But I think he also mentioned it's not something to write home to. Being delayed in mitigation by either 2 or 3 days is not winning any type of race.
Monica, one of the things that I would like to ask is to key back on one of the things Tim said. He was asking about the level of hospitalization. I believe that this is the highest level that we have had since the pandemic started. And you and others have always talked about flattening the curve, and you guys have worried that we're seeing another surge. You mentioned today that we have hit the highest number of cases. I believe that we have hit the highest number of people in one of the 4 hospitals. We are averaging 2 a death each day. Is this the surge that you were? Is this the overwhelming? Is this what it looks like? And I ask that because we are on the verge of being locked back down. As it gets cold, we cannot eat inside if these efforts take place. What do you have to say to people that you haven't said? You have told them to wash their hands and they're not going to do it. You've told them to wear a mask and they're not going to do it. You've told them to maintain 6 feet. It's not working. Do we just have to get punished?
I'm going to try to paraphrase that. I think the overall question is, what we, myself and public health professionals across the state and the country have been saying is that, be prepared for the fall and what's going to bring. And if we don't do our due diligence, if we become complacent, we're going to be in a situation where we're going to have to face harsh realities, such as those mitigation efforts, closures of establishments, things of that nature. Right now, what we are seeing is that upward trend. And compared to previous, I think a great example is someone says, previously we were wanting to be under 20% to move into a new phase. Why is it not the same? And that's because we now have much more testing available here. So the metrics from prior don't necessarily mean the same now. And again, that's how science and data works. But going back to the point is that we are hoping that we put measurements in place, flags or milestones that will allow us to take a pause and reassess as a community so that we don't start growing at an exponential rate in terms of our cases and then mortality. So are we on that wave? Yes. If we start continue on it, then we're going to be on a wave that will be very hard for us to correct. And that's the concern right now, is that by putting us on this kind of alert as a community, we don't want to get to a point where it really is uncontrolled for us. That's not a picture we want to see happen. And so again, the measures that we have are these milestones so that our corrective actions can work. And that's why, make no mistake, sometime in the next few weeks, we're going to be looking at those mitigations very closely in our community. And as a community, we will have the ability to respond appropriately. And I'm asking our community to take on that lead. Wear your face mask. Stay socially distanced, 6 feet apart. Practice a good hygiene. Get your flu vaccine. Again, you don't want to inundate our hospital systems. And then if you are sick, get tested. There are a lot of testing sites in Peoria. We have 2 community-based testing sites. Right now, we're actually operating a pop-up site in Chillicothe. We're going to be most likely getting another test site right on the Thanksgiving week here locally. So again, there are a lot of places to get testing, and now antigen testing or point of care testing is also becoming more and more available. So when you are having symptoms, I'm just going to say it here, it's not allergies this year. It's COVID. Go get tested, isolate until you get your results, and then if I'm wrong, it may take 15 minutes of your life, but at the same time, you're really protecting your neighbor, and that's the key. So to get ahead of this.
So Monica, can you just give us a better idea or maybe an illustration? What does uncontrolled spread of this virus area look like if what we're seeing right now is not indeed uncontrolled spread?
So uncontrolled spread means that you're going to see positivity rates really start just growing, almost doubling in essence. Right now, we've averaged here locally in Peoria County, our 7-day average can be anywhere, I would say, between 5.5 to 7 right now. I think we're inching up higher. Some of our single-day positivity is at 9 or 10%. So really we're watching is that how fast is that growing? It is growing at a rate we really can't control because, again, contact tracing and that investigation work, that's our way of getting information to get ahead of it. If we're at a point where you're seeing, today we have 100 new cases. If tomorrow we're seeing 500 new cases, we won't be able to catch up.
And if you get to that point where you have 500 cases, what are the plans as far as adding additional testing sites and adding places where people can be treated if the hospitals get too full? What happens then?
So the question is, when you get to that uncontrolled community, what does that mean? And you're going to see much more stricter mitigation levels, kind of reminiscent of what we saw in the springtime, but also that stand-up hospital systems. All of our hospital and healthcare systems have plans to address surge issues, and they have those plans. They're ready to activate it. We just don't want them to, and that's on us. If we can wear face masks and we can do all of those key interventions, hopefully we can prevent that from happening.
Monica, do you know on average how many tests we're seeing in the Tri-County area, either like daily or weekly? And then if you could talk about, for example, the president will often comment, oh, well, the reason why numbers are so high is because we're testing so much. I guess from the medical perspective, talk about, why that's good or bad, and if you know the average of number of tests being conducted.
I can't speak to the full average of our Tri-County. I think in Peoria we average, and it fluctuates when we have a pop-up testing event, for example, or we have a long-term care facility that's doing some mass testing. But we're usually between 800 and 900 daily. But we can handle a lot more. I mean, we have a lot of capacity here locally. So again, recommend getting tested. There's a lot of points. In regards to the number of cases attached to increased testing, yes, when you're able to test more people, you're going to identify more cases. And you're also able to then identify those individuals, find out who their close contacts are, and again, try to create that barrier so that you're not creating more spread. So yes, we do want more testing, and we will identify more cases, but we'll also identify those people that, again, those degrees of separation who we can, again, protect, put them in a bubble so that they're not further spreading it as well.
One of the things that I would like to ask is, and I've gotten a lot of calls about this, maybe you can tell folks where this why 8% is a number where you are worried about. Why is it not 6? Why is it not 9? And other people might say, well, what is the prevalence of other viruses? Maybe if we did a test for the cold or the flu or chickenpox, that would be higher. Obviously, those you could treat, and it's a different thing. But what is the 8% threshold?
So the 8% threshold set by the Illinois Department of Public Health looked at data with the CDC and other countries that were doing mass testing to understand from a surveillance point what is that kind of level that we needed to be at. But again, this is a milestone that lets us still correct ourselves. If we kept it any steeper, we would be in a situation where we cannot correct ourselves. So this is a milestone that is very serious to consider because, there's that point of no return. And we really want to make sure that we set those measurements in a place that we can return from. And that's really where the 8% comes into play. That is one of our earliest triggers to say, okay, this is your point to take those mitigations seriously because we can correct it. We still have the option to do that. If we set it any higher, then we wouldn't be able to. And then you're addressing about the other viruses that are out there. Common cold, influenza, chickenpox. I will say, especially for influenza and chickenpox, we have vaccines for that. And we have treatment for that. We don't have that for COVID. So it's not comparing one and the same in this case.
So when we're talking about 8% being that point where it's harder to control and we start running that real risk of uncontrolled, I mean, is that what we're seeing like in the Rockford area where it's now like over 13% positivity and they've implemented even more restrictions than previously? Is that where we're headed to if we don't get things under control, so to speak?
That's exactly right. So in one of our regions, I think it's Region 1, they're now in Tier 2 mitigation because they're continuing to see that high positivity values. And now they're also seeing their hospital values, again, that lagging indicator also move forward. So the resurgence plan, that mitigation, were meant to really create those markers and milestones to give our community a chance to correct itself and get ahead of this. Otherwise, every step of the way, we're going to have further and further mitigations. And again, we don't really want to move all the way back to that additional phase.
Given the rise and given the way that you are talking, ma'am, it seems like we're going to get hit with it. Once we do, from what I can tell, you are in that level for 2 full weeks. How do you get out of it? What is the bone that you can throw to residents here? What do we need to do to bring ourselves back out of that?
So the question is, if we get into mitigation and we are in it for 2 weeks, what do we do to get out of mitigation? We do the right thing. We wear our masks, we socially distance, we get tested if we're ill, we isolate until we get our results, and we do wash our hands and practice good hygiene. I really wish I had a magic answer for this. The fatigue is not just for the public. As professionals that not only personally are addressing this, but professionally are addressing it, it's real. And so there is no magic answer. It continues to be that good work. And I will just say this and kind of maybe close with this, is that I know it can be frustrating. We get a lot of individuals that direct some of that frustration at our staff and at our agency, and we also personally feel it. But at the end of the day, if you want to make sure, as you said, kind of what is that carrot that we can get out of this, if you want to make sure that this doesn't happen, then we're asking, and in fact at this point maybe begging to say, follow those guidance. They work. And really follow them. It means that, again, it's not that your neighbor's there, it's your household. Anybody outside of your household, you're going to wear a face mask. You're going to practice that social distancing. And again, if you're having any of the multitude of symptoms, get tested. There's no excuse in Peoria. Thank you, guys.